Manitoba's COVID-19 situation remains a crisis. The province is adding new restrictions and extending existing ones for another 2 weeks. That starts Saturday. Manitoba reported 8 more deaths today, its highest death toll during this third wave.
Right now we have hundreds of people in hospital fighting for their lives. We have thousands of health providers working day and night to help these Manitobans. We have to stay at home as much as possible.
We're not in a position to reopen, and we are not in a position to send our students who are currently in remote learning situations back into the classroom either.
As well as keeping hundreds of schools on remote learning, Manitoba is banning all indoor and outdoor gatherings with anyone from another household. Retail is limited to 10% capacity, with only one person from a household allowed to enter. There are exemptions for single parents and people who need assistance. Now, many businesses will remain closed. That includes gyms, restaurants, and those that provide personal services like hair salons. Kelvin Gertson is the Deputy Premier of Manitoba and the Acting Health Minister. He is in Winnipeg. Minister Gertson, thank you very much for joining the program today. And I want to start around the question about restrictions. Certainly there have been lots of calls from physicians, from others, to implement greater restrictions to try to get the situation under control. I look at where Manitoba is at right now. Most dire situation in North America. And when Ontario and Alberta found themselves in similar positions, they went for tighter restrictions than you have now. Nobody likes that. Certainly not business owners. Very difficult. But why has your government resisted sort of following what doctors and others have called for around the closure of non-essential businesses?
Well, we certainly haven't resisted difficult restrictions. I mean, we've been in code red since November of last year. In Manitoba today, you're not able to gather with anyone from outside of your home, inside of your home, or even outside of your home. So you can't go to a park with somebody who's not in your family. You can't go to a campground with someone who's not in your family. And when it comes to retail, there are significant restrictions down to 10%. So we have had some of the heaviest restrictions in Canada for among the longest period of time. It's been difficult for Manitobans for sure. Yeah,
but they don't seem to have worked to this point, Minister. You find yourself in a very dire situation in which not only are your ICUs unable to deal with the load that's out there, but you're transferring now dozens of people out of the province, including a 31-year-old woman who, when you attempted to move her out of the province, there was an emergency on the aircraft, brought back to the hospital, and this 31-year-old woman died.
Well, I mean, I would say that in terms of whether the restrictions have worked, we entered the third wave late, probably later than almost any other province in Canada. We had some of the lowest numbers in Canada at the beginning of the year, and certainly like every other province, we are now in the third wave. It does seem that the numbers have plateaued in terms of the number of infections, although plateaued at too high of a level. But over the last 7 days, we've seen either a general reduction or a plateau. So a difficult situation. Nobody would deny that. And that's been true in every province as well. So lots of provinces have had to seek help and different kinds of help, and we're in that situation at this point.
Yeah, and certainly the military now moving into Manitoba to offer additional help. Other provinces have come in to address that need. But I sort of go back to this issue around restrictions, and I look at what your neighboring provinces, Alberta and Ontario in particular, did to try to bring a dire situation under control. What is it that makes Manitoba different from what others had to do to achieve where they're at now, talking about reopening plans?
Yeah, I mean, I don't think that we're different in the sense that the restrictions haven't been significant. I would say that many Manitobans would tell you that they've been significant for a very, very long time, since November being under code red. So that has been in place for a very long time. Again, there are really, really strong restrictions when it comes to gathering with others, and that's where we've seen,
but your code red, your code red, Minister, is not the same as what other provinces had. Like, we can use the semantics around it, but other provinces chose to lock down harder, sometimes for a very long time, but the hope really is lock down very hard, clear the slate as much as possible, and let the vaccines then do their work for the rest of the population.
Yeah, I would say that when you're not able to be with anyone from outside of your household, whether that's inside of your household, whether you're outside of your household, There are significant restrictions when it comes to businesses, churches, houses of worship are entirely closed, and they have been for a long time. Many other things like movie theaters have been closed for a very long time. All the provincial casinos have been closed for a very long time. There are very significant restrictions in Manitoba, and there have been for a long time.
So if you've had very significant restrictions for a long time, why have the numbers not gone down?
Well, again, they have plateaued. I think they've plateaued at too high of a level. But remember, I mean, every province virtually has entered a third wave. We entered it later, so I think that we were able to delay the third wave. Now we're going through ours. In the last week, they have plateaued. There have been a decrease of numbers in, I think, 5 of the last 7 days. And so we think that medical experts are telling us they believe that we are at least at a plateau. But absolutely, we've got to drive them down, and we've been increasing restrictions. There were some additional ones today and last week over the May long weekend. There were additional restrictions. So they continue, and it does look like they're having some effect. But no question, we have some of the similar challenges that every province has had.
You know, I take your point about people are not supposed to be able to gather inside or outside their home with people outside of their household, but people could go and buy a patio set at Canadian Tire, or they could go to Winners. And I know they're not supposed to go with other people from their family, but employees still have to go to all of those places. What do you say to those who are, you know, who may be working, who may have access to various things, but who are consequently at greater risk of exposure at a time where there are very high levels in the province?
Well, we would say that, you know, we follow the advice, of course, of our Chief Provincial Public Health Officer, who has indicated very clearly that the greatest challenge we have is people who are gathering in their households, gathering with people from outside of their households. We haven't seen that level of transmission in a retail setting, where people are generally sort of in and out and not being together in a close area and a close proximity for a long period of time. So in following that medical advice in terms of where is that transmission happening, that is where the restrictions have been the greatest and the longest, and it does appear that they are having an effect over the last week.
I know the Premier in some of his news conferences essentially pointed the finger at people who are engaging in risky behavior, who aren't following even the restrictions that are out there, or people who haven't got a vaccine, although in fairness to many of those people, they weren't eligible for a vaccine often before some of them got sick and have now ended up, some of them, in ICUs or dead. How much do you think it is up to people? How much do you feel that the situation in which you now find yourself as a province is the result of specific people's actions or inactions as opposed to the restrictions that you've had in place?
Yeah, I think like in every province, you're going to find a mix. And so in every place we're seeing in Canada, you have some people who have been following the advice of public health right from the beginning of the pandemic, and you have some that have sort of bucked that probably right from the beginning. So we've increased enforcement to try to ensure that there is that, you know, enticement for people not to go against the rules, to follow those rules. But like in every province, that has been a challenge. There are certainly some who are not following the rules, and that is a problem. It is part of the reason why we have the spread that we have, but it's not the only reason. There are many people, of course, who are going about their life and trying their best to follow the restrictions, and through no fault of their own or through, you know, mistakes. You know, it is a virus, and it's a contagious virus, so it does spread. So I think you get a mix like you do in every place.
Just in our last minute here, Minister, I did want to ask you about this 31-year-old young mom whose own mother did not want her to be transferred out of the province, but was told it was necessary, it had to happen, had to create space because the hospital needed it because of the number of cases out there. She gets picked up by the transport crew, taken out to the airport, something goes wrong, and she is brought back to the hospital and subsequently dies. What would you say to that family, to the kids who were left behind, to the mother of this 31-year-old woman? What do you say to them about the situation in which your province finds itself?
Yeah, I would say to that family and to all families who have lost a loved one to COVID, and my family has lost a loved one to COVID, we offer, and all Manitobans offer, their sincere sympathies. This is a deadly and difficult disease, and people do destabilized very quickly. That is part of what this disease is. I know that our medical professionals are doing everything they can for every patient, whether they're in an ICU, whether they're on a ward, whether they're being air transported by stars around the province, and that has been happening since the beginning of the pandemic. Each one of these tragedies is a loss for every family member, and I think all Manitobans understand that and extend our condolences to them.
Minister Gertson, I know you have busy days, so we certainly appreciate you taking some time with us.
No, thank you very much.
Let's turn now to Wab Kinew, the leader of Manitoba's NDP, the official opposition. He is in Winnipeg. Mr. Kinew, thank you very much for joining us. I would like to just start with the restrictions, the extension of the restrictions, the new restrictions that are announced today. Do you believe it's enough? And if not, what would you have done?
No, I don't think it is enough. You know, we've had a very clear message from doctors, from people working on the front lines of our healthcare system, that stronger action needed to be taken. What you saw today was tinkering by the Premier of Manitoba, a slight extension, but what you did not see was decisive action. I mean, Manitoba is in a unique place in the third wave. So you just heard the minister there say that they delayed the third wave coming to Manitoba, but when you see how bad the outcomes are here, all that means is that they squandered the lead time that we had.
So what would you, Mr. Kinew, what would you do differently? I mean, if you were the Premier right now, what would you do right now to try to arrest this third wave?
Well, I think you need to look at where transmission is still happening and what in the economy is still open. Mm-hmm. Right now, it's the small businesses, it's the gym owners, the restaurants that are paying the price, but this government seems to be biased in favor of the large out-of-province businesses. And so I think that would be one place to look, but also release the transmission data. The provincial government here in Manitoba has not provided a clear picture of what's going on in terms of spread in the community and spread in workplaces. And if you can believe this, here in Manitoba, we still don't have mandatory paid sick leave. So we got a Premier in Manitoba who is blaming people who are in an ICU, blaming people who are on a ventilator, and yet they've never put in place a program that would guarantee people some measure of economic security if they do get sick and have to stay home. But I just wanted to say, David, you know, Manitoba's third wave has taken on a contour that other provinces haven't seen. Manitoba is sending intensive care unit patients out of province because we simply run out of room to care for the sickest of people right here in our own healthcare system. You know, at the time that I'm speaking to you right now, it's about 24 Manitobans who've been sent out of province to Ontario. There's plans potentially to send more to Saskatchewan. And very tragically, in that incident that you were just referring to, we've actually lost a Manitoban, a parent, a mother of two girls. She is somebody who clearly should not have been moved. And so the situation here in Manitoba is an absolute crisis.
Okay, so I just to I'm certainly acknowledging that awful tragedy which occurred, as I understand it, in the Brandon area. I just want to get back to what you would specifically close. So you've talked about releasing transmission data. You have talked about paid sick leave. Would you close, as Ontario and Alberta, for instance, did, would you close non-essential businesses for 2 or 3 or 4 weeks?
You know, I think that an action like that taken a month ago could have made a real difference.
So what would you do? What would you do now?
I think what we've seen from the government is a delay of action. And to me, the biggest mistake this government has made so far is that they cut the number of nurses working in ICU beds. They did so at the second wave of our pandemic, right? If you can believe that, relative to 2 years ago, after we saw the ravages of the second wave hit Manitoba acutely hard, harder than anywhere outside of Quebec, this government made a decision to cut nursing positions in the ICU units, right? In the intensive care units, rather. Now, what we're seeing, the patients being transported out of province is a direct result of that. We have run out of the people power. We have run out of the staff to be able to care for all the people who are getting sick from COVID-19. So the real political dimension of this tragedy that's unfolding in Manitoba was the political decision to cut critical care nurses in our province. That was a political decision, and it is directly tied to the crisis that we're seeing in our hospitals today.
Wab Kinew, thank you very much for your time.
Thank you, David.
Hi, Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.